Cialis and Viagra are two of the most well-known names in men's health for treating erectile dysfunction. But here's the real question. Which one is better for you? Well, at first glance, they might seem pretty similar. And that's exactly what most people think. But the truth is, they are not the same. Depending on your lifestyle, health goals, and how you plan to use them, one could be a much better fit than the other. For example, did you know that one of these medications can last up to 36 hours, while the other typically wears off after about 4 hours? Well, that's a huge difference, and it could have a big impact on your experience and expectations. And what may surprise you even more, both Cialis and Viagra come with additional health benefits that go far beyond improving performance in the bedroom. So whether you are trying to choose between them or you are simply curious about how they really work, you are in the right place. In this video, I will break down the key differences, how they work, how quickly they take effect, what kind of side effects to watch for, how they perform over time, and even some off-label uses that most people have never heard about. Stick around because by the end of this video, you will have a clear understanding of which option might be the smarter choice for you, and why. Welcome back to the channel. And if it's your first time here, don't forget to hit that like button and subscribe to the channel. First, let's start with the basics. Viagra, also known by its generic name, Sildenafil, was first approved back in 1998. Interestingly, it was originally developed as a heart medication, believe it or not, but doctors quickly noticed an interesting side effect, and the rest is history. Cialis came along a few years later in 2003. Both drugs belong to the same class called PDE5 inhibitors. Now that may sound technical, but all it means is that they help relax and widen blood vessels, especially to one very specific area of the body, allowing for better blood flow. And that improved blood flow is what helps men get and maintain an erection. But here's the key thing people often misunderstand. These medications do not just magically trigger an erection. You still need to be sexually aroused. The medication just helps your body respond better when the timing is right. So what are the core differences between Cialis and Viagra? Well, it all comes down to how quickly they work and how long they last. You see, Cialis usually kicks in about 30 to 60 minutes after you take it. But here's the game changer. Cialis can last up to 36 hours. That's right, a day and a half. This explains its nickname, the weekend pill. You can take it on a Friday night and still be good to go on Sunday afternoon. Now, just to clear up a common misconception, this does not mean you will be walking around with an erection for 36 hours. It simply means the medication is in your system and ready to work when you are ready. Viagra, on the other hand, also kicks in within 30 to 60 minutes, so about the same, but it has a much shorter window, about 4 to 6 hours, tops. Because of that, timing becomes more important. You will want to take it closer to when you expect intimacy. Once that window closes, it is out of your system. So what does this mean for you? Well, if you are looking for more flexibility and spontaneity, Cialis gives you a wider window. But if you prefer to plan things out, Viagra is a solid, reliable choice for when you need it. No more, no less. In the end, it really comes down to your lifestyle, your preferences, and what your doctor recommends. Now here's another key difference, and it's an important one. Food. It may not be the first thing you think of, but what you eat can actually affect how these medications work. For instance, Viagra can be affected by high-fat meals. So if you've just had a big dinner, something like a steak and fries or a juicy burger, it can slow things down. The medication may take longer to kick in, or it may not work quite as well as you would expect. Cialis, on the other hand, things are a little different. Food doesn't affect it the same way, so you do not need to worry about what you have eaten. That makes it a lot more flexible and easier to fit into your routine. And speaking of convenience, here's where Cialis stands out even more. There is a daily option. You can take a low dose every day, so it stays in your system and keeps you ready whenever the moment's right. No need to plan ahead or time things perfectly. Viagra does not have a daily version, it's only meant to be taken when you need it. So now, with all that in mind, let's zoom in and break down the pros and cons of each, starting with Cialis. You see, one of the biggest advantages of Cialis is the long duration. That 36-hour window gives you more flexibility. You are not watching the clock, and you do not have to perfectly time things. If something interrupts the evening, maybe dinner runs long or you get tired, you've still got plenty of time. It supports spontaneity, and that can be a huge relief, especially if anxiety around performance is a factor. The daily low-dose version also means you are always good to go. And for men in long-term relationships, that can feel more natural, less clinical. And here's a bonus most guys don't know. Cialis is also FDA approved to treat benign prostatic hyperplasia, or BPH. That's the fancy name for an enlarged prostate. So if you have urinary symptoms, like needing to pee frequently or trouble starting a stream, Cialis may help with that too. But it's not all upside. Cialis can cause side effects such as muscle aches or back pain, and because it stays in your system longer, those side effects can last longer too. Some guys feel it takes a little more time to kick in, and if you go with the daily version, you're committing to a daily medication, which may or may not be necessary for you. Alright, that's Cialis covered. Now let's shift gears and take a closer look at Viagra. Viagra's main strength is that it's fast and effective. It's ideal for one-time use when you know what the evening holds and just want to make sure things go smoothly. It's been around for over 20 years, so its track record is solid. It's reliable and predictable, and for many men, it works great. But it does come with more timing pressure. That shorter 4 to 6 hour window means you have to plan your evening a bit, and it's more sensitive to food, which can complicate things. Side effects like flushing, headaches, nasal congestion, or even visual disturbances, like blue-tinted vision or increased light sensitivity, can be more noticeable with Viagra. Again, not everyone gets these, but they are common enough to mention. So the big question is, which one is right for you? Well, here's a simple way to think about it. If you prefer a more spontaneous experience, maybe you're intimate a few times a week, do not want the hassle of planning around a pill, or are also dealing with urinary symptoms due to an enlarged prostate, Cialis might be a better fit for your lifestyle. On the flip side, if you only need help once in a while, don't mind a little planning, want a strong short-term effect, and prefer taking medication only when you need it, then Viagra could be a better choice. At the end of the day, it's not really about which one is stronger or better. It's about what works best with your lifestyle and your goals. So ask yourself, do you want to be ready anytime? Or are you more of a just when I need it type? Whatever the case, talk to your doctor and choose the option that fits naturally into your lifestyle. So by now, you have probably got a better idea of which ED medication may fit your lifestyle better. But here's where it gets interesting. A lot of people don't realize these meds can actually do more than just improve performance. So let's talk about some of the lesser-known benefits that could make a big difference in your overall health. First, as I mentioned earlier, Cialis is FDA approved to treat an enlarged prostate. That means if you are waking up multiple times a night to pee or dealing with a weak stream or urgency, Cialis may help with both ED and urinary symptoms. That's a big win, like hitting 2 birds with 1 prescription. Second, both medications support vascular health. Because they help blood vessels relax and function better, there is evidence they may have positive effects beyond just ED, potentially improving circulation elsewhere in the body. Third, Viagra or Sildenafil has its own set of bonus uses. It's approved for treating pulmonary hypertension, which is basically high blood pressure in the lungs. Plus, research is starting to explore how these medications can help exercise performance for people with certain heart or lung conditions. Think better stamina, better oxygen flow. And finally, let's not overlook the psychological impact. Just having a dependable option can reduce anxiety, build confidence, and even strengthen intimacy with your partner. That peace of mind alone can make a huge difference. But as with any medication that affects your body, it's not just about what they can do. It's also about when and how to use them safely. So let's take a minute to talk about safety, because it's crucial. If you are taking nitrates such as nitroglycerin for chest pain or heart conditions, do not take Cialis or Viagra. The combination can cause a dangerous drop in blood pressure. Also, if you have had a recent heart attack, stroke, or have unstable heart disease, you need to speak with your doctor before using these medications. The same goes if you have certain eye conditions such as NAION, which could increase your risk for complications. Now the good news is, most people tolerate these meds well, but everyone's body is different, and that's why it's so important to have a conversation with your healthcare provider to make sure it's the right fit for you. And here's one more thing. Let's be honest, these medications are tools, not magic. If you are not sleeping well, eating poorly, super stressed, or dealing with underlying health issues, no pill is going to completely override that. The truth is, you will get the best results when you are also taking care of the foundation. Things like maintaining a healthy weight, fueling your body with whole nutritious foods, staying active, and taking care of your overall well-being. Yes, the meds can absolutely help, and for many people they do. But they work so much better when they are part of a bigger picture of self-care and healthy habits. And there you have it. Remember, knowledge is power, and you have the power to make informed choices for your health. Thank you for watching.